We're back again with resistance, pressure, and flow. First of all, allow me to apologize for what's going to happen. We're going to have to go through a lot of equations. So here's another blank slide. It's dedicated to writing out and understanding equations. The truth is, you need to know and understand these. I am hoping that if you stare at them while I explain the concepts and possible applications of the equation, you will have them ingrained in your mind as you progress. So let's start with the first one. Pressure is equal to flow times resistance, right? Of course. So pressure is just a relative term, just like voltage. So, for example, here we have our vessel, and then this is pressure at one side of the vessel, and this is pressure at the other side of the vessel. The pressure from this upstream location only means something relative to the pressure in P2, or the second location. It is a relative pressure difference that drives flow. So the difference between the two is what actually will drive our fluid flow in the case of blood. The factors in the equation for resistance are something that is really important for us to consider and reason through. So the equation for resistance equals the driving pressure, or the change between P1 and P2, divided by flow, and this can be represented as 8 times the viscosity times the length of the vessel over pi r to the 4th power. So as you can see here, resistance is kind of dependent on a couple of things that are important to us, particularly if you change factors in the numerator or denominator. If you increase factors in the numerator, such as viscosity or the length of the vessel, you will obviously increase resistance. You don't even really need to worry about these, because in no way are you going to change the length of a vessel in the human body unless you're doing some sort of surgical exploration and grafting vessels. So I don't even worry about length, even though it is consideration. While a decrease in the only factor in the denominator will exponentially increase the resistance. Let's examine each component more in depth. So viscosity, which is this nice little fancy N. Thank you, our Greek ancestors, for that. So viscosity is the intrinsic ability of blood to flow against itself. So let's kind of visualize that here. I like to visualize flow of blood in a vessel like a bunch of arrows, just like this. These arrows are vectors of blood flow against themselves. Each arrow is the exact same as the other, but they do have some intrinsic friction between each other, right? The more viscous the arrows that represent blood flow are, the more they will rub against each other. So how can we increase viscosity if we are talking about blood? Well, if we increase the concentration of stuff that is normally found in the blood, we certainly can increase the interactions between each blood flow vector arrow. Some great examples of increased viscosity are what? What are things that are in blood? So increase in red blood cells, such as in polycythemia vera, increased numbers of proteins that are floating in the blood, such as in multiple myeloma, and an increase in the viscosity due to a very unique situation, which is hereditary spherocytosis. And this is a particularly high-yield concept because it allows them to tie in some sort of pathology with the physiology of this equation. So can you remember what structural membrane protein in red blood cells is deficient in this disease of hereditary spherocytosis? And that would be spectrin. Remember, spectrin is really important for maintaining the red blood cell membrane. So this is our red blood cell up here. They're nice and oval shaped, and they can deform properly when passing through the sinusoids of the spleen. When the red blood cells squeeze through the sinusoids of the spleen, they have to conform to the different shapes of those chambers. It's like an underground cave system. You have to be able to squeeze through the different caves of the spleen. If there's a deficiency in spectrin, then every time they squeeze through these cavities or canals, there will be little outpouchings due to defective membrane integrity. So little outpouchings will form, just like these guys. So our macrophages in the spleen see these, and they absolutely just love eating these guys off. That's their job, is to maintain red blood cell shape and integrity by removing abnormal blebs due to defective spectrin synthesis that would be present in someone with hereditary spherocytosis. So what is happening though? The splenic macrophages are going to take these little blebs off so that the red blood cell membrane will be restored to a smooth shape. But this comes at a price where red blood cells are now no longer oval, but they're more spherical in shape. Hereditary spherocytosis is telling us that the red blood cells are spherical, hence the name sphero, and then cyto means cell, and osis tells us exactly what's going on in this disease. There's a large amount of cells that are spherical. So we lost surface area and volume, causing a spherocytic-like shape. Spherocytes are terrible at changing their conformations and will kind of get stuck in vessels. This causes an increased viscosity because they slow down flow due to the decreased ability of those red blood cells to change their conformational shape. On the opposite hand, we can decrease viscosity by having less red blood cells, which is the case in anemia. So a decrease is due to anemia, and that makes sense because there's just less interactions between red blood cells to slow down blood flow in these vector arrows. The most important factor in the equation is the radius of the small vessel arterioles. This is the only thing that we can actively control, especially with medications such as alpha-1 agonists. The arterioles are basically immediately before each organ system. They act to regulate blood flow that goes into the capillaries that provide the parenchyma of each respective organ. The arterioles are much less numerous and have very small radii. They occur right before going into a big capillary bed, so they look like this. This is your arteriole, and then there's a bunch of capillaries coming off. By controlling the diameter of this arteriole feeding this capillary bed is the main way that organs control their blood supply. This is why these total peripheral resistance arterioles are responsible for the mean arterial pressure calculation. Let's visualize how resistance increases due to vasoconstriction. So let's look at this vessel. Obviously it has a very large diameter in comparison with this vessel. If you decrease the diameter of the vessel from this to this, the highest resistance to flow is going to be obviously present here where the blood flow vector arrow interacts with the vessel wall. Do you see how instead of only 2 arrows out of the total 1, 2, 3, 4, 5, 6, 7, 8, 9, 2 out of 9 only interact with the vessel wall as opposed to 2 out of 4 vector flow arrows interact with the vessel wall? There's much more resistance. The ability for blood to flow against itself increases as we go towards the middle because it's only interacting with layers of itself as opposed to on the periphery where it is interacting with the vessel wall. This is a very simple way to think about how the diameter of a vessel affects blood flow. Do you see here at the bottom how only 4 sheets of blood flow and 2 of them are interacting with the vessel wall? This is not advantageous because we want more internal flow within the blood itself, because blood is much more able to flow against itself than rubbing against the vessel wall. That is why radius is to the 4th power in our equation, because any changes in the radius are going to be the most influential in determining the resistance of blood flow in these arterioles here and here. So obviously, for example, if our diameter here is 8 millimeters and here it's 3 millimeters, if that is in the denominator of your equation, 8 to the 4th power, you're going to be dividing by a much bigger number. So your resistance will be obviously less, as opposed to if you are dividing by a much smaller number of like 3 to the 4th power versus 8 to the 4th power. Alright, let's not move on yet. Let's discuss another important conceptual thing that is obviously represented as an equation. A lot of these things are represented in the form of equations, but it's the concept that is behind it that is the actual important part. So the organization of the vessels in the body can be said to be either in series or parallel. The truth is that a majority of the time they occur together. Let's talk about one that is in parallel first. So in parallel arrangement obviously means that the vessels are in parallel formation relative to each other. So if you imagine this is the heart, and then we know that the aortic arch is formed after the left ventricular outflow tract. A great example of vessels that are arranged in parallel are right here. They come directly off the aortic arch. So this is our left subclavian, our right innominate, and our left common carotid. These are in parallel arrangement, as opposed to something that is in series, and it's usually within an organ. So this is the main artery that's supplying the organ. So for example, if this is the renal artery, and then it divides into this segment, and these continue to divide even more, these are in series because this vessel directly influences the resistance or ability of blood to flow from here and here into this segment, and then this vessel influences the ability of blood to be received into this segment. It is a continuation. I like to think about it as one long continued chain of passing on something in between the vessels. Now what's very unique is that if you think about how this vessel that we just drew to understand the arrangement of series, is that on the other side there can still be branching, like so. So that these branches here are actually in parallel with these branches here, because of this branch point, right? Even though they're all supplied by the same artery, which is this main one, this main artery is in series with these continued vessels, and it is also in series with these continued vessels. But this segment of branch vessels is in parallel with this segment. And that's how the body is arranged to maximize the ability to control blood flow, so that there are some things that are in series and some things that are in parallel. And there's obviously a difference in the calculation. So if you think about the calculation for the resistance of vessels in series, because everything is kind of connected, in which the ability of blood to flow in this segment will influence the ability of blood to reach this segment, or this segment, is rather important. And that is why you have to add them together. So the total resistance is, so if this is vessel 1, and this is vessel 2, and then these little branches down here are vessel 3, they're all influenced by each other, in the sense that whatever the resistance in the main contributing vessel obviously has an influence on the next, and then whatever the influence of the change in vascular tone is in 2 will obviously influence 3. So that is why you add the resistances together. So R1 plus R2 plus R3 gives you the total resistance for that group of vessels that appear in series. In the different situation where we're thinking about things in parallel, there's no direct relationship as far as this vessel is a continuation of that vessel. There's actually a parallel arrangement, and that is why you have a calculation that obviously summates to a much lower resistance, right? Because you're 1 over the resistance is now a fraction of what these values were, because there's less of an influence of vessels arranged in parallel on each other as far as resistance goes.